Did you blow it last time? And can Republicans win on health care in 2020?
Well, I've been up here for 90 days. When I came up here, the government was shut down, so it's been pretty dysfunctional since I got up here. I think it's great that the president cares about health care and is talking about it. The big issue we ought to be focused on is, well, how do we drive down the cost of health care? That's the issue. It's not access, it's cost. So I put a bill out on Friday that said, you know, Americans are not going to pay more for drugs than Europeans pay. It's unfair to Americans. And when you go to the pharmacy, you ought to know what things cost. It's pretty basic things, but we've got to drive down the cost of health care, and I'm going to start with prescription drugs.
All right, so you put out your bill on that. The president, however, says Republicans will wait until after 2020, the election, of course, to hold a vote on a replacement to Obamacare. Was that the right move, or is this something Republicans should be addressing now?
Well, I think what everybody ought to be addressing, whether you're Republican or Democrat, is the issue. The issue is cost. The health care costs too much, and when it costs too much, you don't get it. I grew up in a poor family. My mom couldn't afford health care for my brother. That was a big problem. I want to make sure people can get health care. So let's start with prescription drugs, but let's go piece by piece and figure out how we drive the cost down for health care so people can get more health care.
Let's talk about exactly with your Transparent Drug Pricing Act, how that might in any way reduce the cost. I come from, of course, the UK, where we have a socialised healthcare system where the taxes pay for it. Therefore, my drugs are incredibly cheap when I go to the pharmacy. How are you looking to bring transparency?
Well, I'm doing the exact same thing in this bill that I did in my business job. I ran the largest hospital company. I had hospitals in America and in the UK and in Switzerland. And I told the pharmaceutical companies when I was there that I'm not going to pay more in America than what I pay there. There's no logical reason why Americans pay more for these things. And so, again, I'm going to start with prescription drugs, but we should not be paying more. So my bill says Americans will not pay more than people in Japan, in Canada, in the UK, Germany, and France. On top of that, insurance companies should tell you what your copayment is and not change it for the year for your drugs. They know what they are, so let's be transparent and treat people with respect.
All right, so you've made clear your plan to address costs of these pharmaceuticals, but we also know that the courts are challenging Obamacare, and this is a very real possibility that the courts could strike down Obamacare. Do Republicans have a plan if that happens? Because that would impact, what, 20 million Americans who rely on the Affordable Care Act, 133 million Americans with pre-existing conditions. What would be the game plan then?
Well, first off, what we know is Obamacare's not worked. Even the Democrats are trying to move to Medicare for all because they know Obamacare didn't work. But the first thing we need to do is let's pass legislation that says that if you have a pre-existing condition, no ifs, ands, or buts about it, you can still buy health care insurance and get health care insurance, and you can stay on your parents' plans until you're 26. Those are two good provisions in Obamacare. But premiums have skyrocketed, co-payments have skyrocketed, deductibles have skyrocketed under Obamacare. As Democrats get involved in the access side, what do? They drive up the cost for everybody. When you do that, you reduce access for health care. I'm going to focus on how you drive the cost down. You've got to focus on how the delivery system can be more efficient. And again, I'm going to start with the prescription drugs, but I'm going to go through the entire industry and say, how do we make it less expensive?
It's interesting, of course, with your background, it's unsurprising perhaps that President Trump has asked you, among other senators, to be looking to create the health care plan of the future. Is that still happening, that you've been asked to sort of strategize about what it might look like, a Republican view of health care in the future?
Well, I've been up here for about 90 days, and I can tell you there's a lot of people that are looking at how you improve the system. And every time I talk to them, I always say you've got to start with cost. And so there's a lot of discussions about should we have drug price rebates. You know, there's a lot of things. Surprise bill, and there's a lot of issues. And I just want to tackle piece by piece. I'm an incrementalist. In business, what I did was I said, what can I fix today? And then what can I fix tomorrow? And I just kept doing it every day. And I want to start with the biggest problem I see right now is drug prices.
Senator, I want to pivot here because we want to talk about Puerto Rico. Senate Democrats blocked a Republican disaster bill that would have helped your constituents. They said it lacked enough aid for Puerto Rico. Should Republicans have given more money in the bill to Puerto Rico?
Well, first off, I've been to Puerto Rico 9 times since Maria hit. This is just Chuck Schumer politics. It's all this is. He's trying to act like he cares about Puerto Rico when I worked hard to get the $600 million in for a food nutrition program in that bill, on top of taking care of Floridians and Georgians and the others from the disaster of 2018. And Chuck Schumer, even though he didn't spend time making sure that Puerto Ricans would take care of after Maria. He didn't go there. He didn't make sure that relief centers were open in New York. I did that in Florida. So he's just doing this as a political ploy. Think about it. When Sandy hit, he complained that they didn't have their disaster money in 91 days. We're now more than 5 months since the disasters that hit my state and he's sitting there not letting. He is sitting there by himself and making sure this disaster relief bill doesn't go through. Let's pass the bill that we know the president will sign. It has money for Florida and other states and Puerto Rico. And then if we need to do more, let's do more.